Hello and welcome to the Physio Information Podcast. I'm your host, Kirigo. Today I'm going to be talking about bladder control solutions for adults, how physiotherapy helps with incontinence from stroke, menopause, and more. Urinary incontinence is more common than most people think, affecting millions worldwide. Whether it's caused by menopause, stroke, childbirth, or aging, bladder leaks can be embarrassing and disruptive. But here is the good news: physiotherapy for incontinence offers real solutions to regain bladder control. If you're struggling with stress incontinence, urge incontinence, or post-stroke bladder issues, you're the person I am talking to. And this information that I'm going to give you today will give you a guideline on effective pelvic floor exercises, bladder training techniques, and physiotherapy treatments that can help you. So, uh, adults who suffer from urinary incontinence mostly are in their menopause or they have a health issue like stroke. So, I'm going to talk about it in menopause and urinary incontinence and give you a story of a lady called Banjiru who was 52 years old. This lady is a teacher, and menopause brought an unexpected challenge, that is bladder leaks. So one day she laughed at a student's joke and felt a leak. At first she dismissed it, but as months passed, simple actions like sneezing and coughing led to accidents. What she didn't know was that her levels of estrogen had dropped due to menopause, and this had resulted in weakened pelvic floor muscles that support the bladder. This would lead to something we call stress incontinence, where any pressure on the bladder caused a leakage. So after months of embarrassments, Manjiro, who is the character of my story, discovered pelvic floor physiotherapy. By practicing Kegels, bladder training, she was able to core strengthening exercises, she was able to regain control over her bladder. No more avoiding laughter. Another story that I'm going to tell you is of a guy called James, who is 67-year-old accountant and who had a stroke that changed everything, including his bladder control. Weakness on one side of his body made it harder to get to the toilet on time, and sometimes he didn't even feel the urge until it was too late. So why would someone with stroke have incontinence? One, a stroke can damage the brain's ability to control the bladder function. Two, weakness in the core and pelvic muscles makes it harder to hold urine. And three, some stroke survivors experience urge incontinence, where suddenly they need to go, but they can't make it in time. So what Jane's doctor recommended was pelvic floor physiotherapy, which included Kegel exercises, bladder training, and core exercises, such as planks and bridges to stabilize the pelvic area. If you are wondering whether men require physio for pelvic health, the answer is yes. Within months, James saw improvements and he no longer feared leaving the house and he regained his confidence. So, what are the best physiotherapy treatments for incontinence? Whether incontinence is due to menopause, stroke, pregnancy, or aging, physio can offer effective non-invasive solutions to improve bladder control. Some of the things of pelvic floor physiotherapists to take you through is pelvic floor muscle training, also known as Kegels. This is best for stress incontinence. This Kegel strengthens the muscles that prevent leaks. How you do a Kegel? You contract your pelvic floor muscle as if you're stopping urine flow for 5 to 10 seconds. Then you relax. You repeat this 10 to 15 times. and do this 3 times a day. Studies show that pelvic floor exercises can reduce leaks to up to 70%. Another thing that you can do is bladder training for urge incontinence. This is similar to what James had. If you remember James, the stroke patient. Um, how you do this is you retrain the bladder to reduce frequent urination. How you do it? You delay urination for 5 minutes. When you feel the urge, you gradually increase the interval between bathroom trips and you track the progress using a bladder diary. Another thing that a pelvic floor physiotherapist will take you through to help you with your bladder control is core strengthening exercises. A strong core and pelvic floor work together to support bladder control. You should try doing bridges, planks, and deep abdominal breathing. Another tool that a pelvic floor physiotherapist might use is electrical stimulation and biofeedback. These are instruments that are found with the physiotherapists, then they should take you through how they work. So for severe pelvic floor weakness, low-level electrical stimulation activates muscles that are difficult to contract voluntarily. How biofeedback works, it helps people learn how to contract the right muscles for better results. But there are other solutions that can help with bladder control and incontinence. So I'm going to give you a couple of lifestyle tips for managing incontinence. One is maintain a healthy weight. Our excess weight puts pressure on the bladder. Limit bladder irritants. Avoid caffeine, alcohol, and acidic foods. Stay hydrated. Drink 6 to 8 glasses of water daily, but avoid overloading your bladder. Use a scheduled bathroom routine. A scheduled bathroom routine. Empty your bladder every 2 to 4 hours to avoid urgency. So I'm going to finish by telling you why seeking help is important. One, my client, Wanjiru, who is the star of this story, almost let embarrassment stop her from seeking help. James also that his incontinence was something he had to accept after he had a stroke. But physiotherapy changed their lives. If your loved one struggles with urinary incontinence, don't suffer in silence. Pelvic floor therapy, bladder training, and physiotherapy exercises can help you regain the confidence and the control you need. Thank you for listening. Please subscribe, like, and let me know what you would want to hear next in the comment sections. Thank you. My baby wanted to be part of the podcast, so you can hear her in the background. We apologize. Yes, but she wanted to be part of it. Thank you.